Minister Balakrishnan stressed that existing preventive and control measures must continue to ensure long-term sustainability in combating the virus. Mei Wong has more.
In a highly mobile and hyper-connected world today, it's inevitable that the COVID-19 virus is causing a profound impact across various nations. Within ASEAN alone, about 50 million people travel every year. Singapore, for example, is home to 4 of the 10 busiest air routes in the region, and although China is reporting fewer new cases domestically, it doesn't mean the danger is over. Singapore's Foreign Minister Vivian Balakrishnan says coordinated and coherent actions are necessary to cope with the COVID-19 challenges.
If the cases remain confined to clusters, like what we have now, and we don't see further evidence of widespread community transmission, that will be
in the sophistication of healthcare systems within Southeast Asia itself. At the special ASEAN-China meeting in Laos on tackling the coronavirus, the Southeast Asian grouping showcased its solidarity with this.
Stay strong, China. Stay strong, China. Stay strong, ASEAN. Stay strong, ASEAN. Thank you, Excellency.
China's foreign minister acknowledged the support and encouragement the regional countries have given Beijing as both sides pledge to work on extending collaboration, especially in the public health sector. Minister Wang Yi revealed plans to hold an ASEAN-China leaders meeting and emphasized the importance of a rebound in economic activities between the region and China.
中国和东盟情同手足，命运与共。面对疫情，加强团结、深化合作是唯一正确的选择。恐慌比病毒更可怕，信心比黄金更重要。
The special meeting enabled the regional ministers to have a timely, candid and comprehensive discussion with China. All of the countries acknowledge that Beijing is working hard to control and prevent the spread of this virus. They also recognize the seriousness of this epidemic, agreeing that only with further cooperation and coordination can they win the battle against this virus. Mei Wong, CNA, Vientiane.
Good evening and welcome. Let's take a look at our top story. We've been tracking the outbreak of the coronavirus across the world. We've brought you ground reports from Wuhan. But now the focus is on one question. Is the coronavirus a biological weapon? The question has been doing the rounds for a while now. It's been on our radar. Now the claim is that the coronavirus is a weapon made by China and that the virus leaked out of a laboratory. Now, so is it true? Was the coronavirus made in a laboratory? Did someone release it just to cause harm? Let's begin with the claim and its origins. British newspaper The Daily Mail was among the first to report this story. There is a lab in Wuhan close to the animal market, and the newspaper suggested that the virus could have leaked from there. The same report claims that the SARS virus also leaked from a lab in Beijing. Another report, this one from the Washington Times, takes this theory a step further. It goes on to claim that the coronavirus could have originated in a lab. The story quotes an Israeli biological warfare analyst. More such reports followed, and they only fueled speculation. One such report says that the virus can be traced back to Canada, and that 2 Chinese agents smuggled the coronavirus from Canada to China. At the center of all these claims is the Wuhan National Biosafety Laboratory. It's a level 4 lab. It was built to study diseases like Ebola and SARS. It conducts research on deadly viruses. and it is barely 32 kilometers from the Hunan seafood market, which has been confirmed as the epicenter of the coronavirus outbreak. All reports suggest that the virus actually leaked from this facility, from this laboratory. Now, at this point, all such reports are in the realm of conjecture. There is no credible evidence to back them, and several experts have dismissed these claims as misinformation and conspiracy theories. Let's take these theories one by one. First, did the virus originate from a laboratory? While there is no scientific evidence to prove this, two agencies, the Center for Disease Control and Prevention and the World Health Organization, are investigating this outbreak. None of them have called the coronavirus a biological attack. They have traced the origins of this virus back to a seafood and animal market in Wuhan, not to a laboratory. Number two, did the virus originate in Canada, more specifically from Canada's National Microbiology Laboratory, or the NML? Now, reports say that in March of 2019, a mysterious shipment of exceptionally deadly viruses from this Canadian lab ended up in China. Scientists from Canada said the viruses were potential bioweapons. 4 months later, a group of Chinese virologists, later called Chinese agents, were expelled from this lab. Now, did they smuggle the virus? Again, experts have dismissed this claim. The reports name a Chinese woman called Zhang Guo, and she was working in the Canadian lab. The government of Canada has been reported as dismissing the report. Yes, the Chinese researcher was removed from the Canadian lab, but she wasn't charged with anything. And some reports say that there were issues with her paperwork and protocol. So there's nothing concrete yet to link the virus to the lab, but questions hang. And for a change, the questions bothered the Chinese government enough for them to issue a clarification. China, uncharacteristically, has even issued a denial. Now, guess who else jumped in? The Russian media. They have their own theory. They have accused the United States of triggering this outbreak in Wuhan. They too call the coronavirus a biological weapon, only that it was created by America to target China.
If it comes here, where's our resources? You know, it's a harder thing to fight an epidemic in a democracy. It's a harder thing to fight when the internet can just scream all kinds of lies, whereas they've been locking people up in China for going on Weibo and telling the truth. And they're still locking people up.
And explain what that truth is.
Well, for example, there's a young doctor who is an ophthalmologist in Wuhan, who was one of the first to spot that there was a new kind of pneumonia afoot, and he thought it looked a lot like SARS. He went on social media, on Weibo, he put out his analysis of it, and they immediately arrested him, and he was thrown in prison.
Of those who might have been incubating and therefore had not shown any symptoms yet, the number approaches 44,000. The 2019 novel coronavirus epidemic that started in Wuhan, maybe it is not a prediction, but it is in preparation as a precautionary principle. As a precautionary principle, we have to be prepared that this particular epidemic may be about to become a global epidemic. Then we are looking at substantial, draconian measures limiting population mobility that should be taken sooner rather than later.
Now globally, in the number of those killed, well, that's something that from a PR perspective, China certainly wants to push back against and show that they still have this under control and that they're still trying to go forward with what they liken to almost a war-like, a battle, if you will.
Death toll from this has now surpassed SARS.
And we see that slowly different parts of the planet are starting to realize, you know, this could come here. And they're starting to talk about readiness. I fear they're too late, that everybody's dragging their feet and getting ready for this. And I think this is going to really explode.
Goodness.
It's out of control in China. There are accusations that officials in Wuhan have been manipulating data in order to have the data reconciled with a 2% case fatality rate. So if you only report so many cases,
Right.
and then you have a fatality rate, then somehow it comes out at 2%.
Interesting.
A very different city on the other side of China that is having a huge outbreak reports a 4.8% case fatality rate.
We can expect to see ongoing transmission by humans to humans, and that's what really concerns us. If someone with this virus lands in your hometown or your area, sits in an emergency room, waiting room for 3 to 4 hours, you could see a number of cases. You know, screening individuals for their temperature at airports is really not an effective way to detect if someone has this virus or not. I have often likened it to fixing 3 of the 5 screen doors on your submarine.
Osterholm says it can take up to 2 weeks for an infected person to show symptoms.
It makes it seem as if we're doing something, but frankly, the benefit of all this airport screening is really questionable.
And
are we going to be able to identify the animal source, get it out of the market, stop it, so all we have to do is stop future human transmission? Or is this now here with us for the future, for which at that point we're going to be dealing with this for a long time to come?
You know, this is really hard, Amy, because China's doing things that really no other nation on earth could do. It's a combination of an authoritarian government and, you know, tremendous infrastructure. They built a 1,000-bed hospital in Wuhan in 8 days. It's admitting patients today. I witnessed them building hospitals in the provincial areas in 6 days, 7 days. And I'm not talking about a slapdash little shed. It's a real sophisticated, you know, negative air pressure hospital. But the measures they're having to resort to are so extreme. You know, basically 100 million people in the nation right at this moment are in some form of shutdown or lockdown. I mean, Wuhan is 11 million people, and Beijing is essentially under a de facto quarantine. The scale of this, I just can't underscore enough. There's no other nation on earth that could do this right now. We certainly couldn't, nor would we. Can you imagine how many days it would take just to get approval for a piece of land to build a hospital on in the United States? Here in New York City, we'd be bickering on it, you know, 2 years from now. To build a high-end hospital in 8 days, there's no other country. Forget it. When we should be watching what they're having to go through and thinking, well, what will we do? So what's happening now is that there's almost a lockdown of information on top of everything else. So let me just say what is the appropriate way that Americans should be looking at this right now, because we're at that danger moment in the United States between sort of being disease voyeurs, watching what's unfolding overseas with some strange interest, versus going into panic because we think it's coming to us. Just the fear of something that's actually thousands of miles away has made us run out of masks. And I challenge your viewers to go out and find a face mask right now. Everybody's lying. People are making huge profits. There's hoarding of masks all over the world. The fact is, almost all the face masks that work, that are medical face masks, are not made in the United States. They may be distributed by a U.S. company, but they're made in, fill in the blank, China. Already panicked buying. You're hard-pressed to find medically designed latex gloves right now in drugstores anywhere in the United States. Amazon's out of masks. So if you hit the point where Amazon.com can't fill it, well then, you know, you're in real trouble. Well, certainly the numbers of people who every year get the flu dwarfs any epidemic. So you could use that, and people always do, as a red herring to say, so why are we so worried about this other epidemic? It's trivial compared to the flu, blah, blah, blah. Well, there's 2 big things to think about with flu right now. One is, yeah, why do we keep having this high death rate from flu? I mean, that's an indication that the American people are not listening to public health, they're not getting vaccinated, they're not taking precautions, and they sort of have a lackadaisical attitude towards it until they get really sick. So that shows the level of the struggle for the public health system. But also, you don't want to get the flu right now and have it be mistaken for coronavirus. And since both have respiratory symptoms and high fever, that would be a problem. So this is all the more reason you should get vaccinated and reduce your chances of getting the flu and being misdiagnosed or having your real coronavirus missed because they thought it was the flu. well, what's upsetting to order of society more than an epidemic? And so the initial response of party officials whenever there's an outbreak is to stifle it as quickly as possible and stifle all news and information about it and spend as much time arresting, as I wrote about several weeks ago when this was first starting, that they were spending more energy arresting people for talking about this epidemic, almost all of them healthcare workers, by the way, than they were in dealing with it and confronting it. So by the time they actually put out honest numbers and actually start telling the world the true toll, we're several weeks in and we have a huge problem on our hands. And then now they're just racing to keep up. The Hong Kong University has a spectacular team of epidemiology statisticians who've been through SARS, been through bird flu, on and on down there. And they've been analyzing the numbers of cases and reports through a variety of means. And they've shown the underreporting rate is pretty consistently by more than 50%. In fact, considerably more. And the true number at this moment is significantly larger.
So where do you see this going? How do you see this playing out? And maybe based it on what you saw, what happened with SARS?
Well, when you ask, why did SARS end? You know, you get different answers. In China, one of the most common responses is to say, because the weather changed. As if the virus somehow was related to cold weather, and that as summer approached and it got hotter, the virus disappeared. That makes no sense to me biologically at all. It may make sense in terms of surfaces. Certain cooler surfaces may harbor virus longer than a hot surface, but other than that, it doesn't make a lot of sense to me. What I observed was that China basically stopped it by doing a massive fever and quarantine program across the entire nation. So it was brought to a stop by a level of vigorous and robust action. But you see, they're doing the same thing now, and as I mentioned before, it's all based on fever checks, and we now know this virus can spread from people who don't have fevers. So they're building a policy that biologically is flawed, won't work. So when people ask me, where is this all going? I say, look, this is much worse than SARS. It is not as terrifically dangerous as a virulent flu epidemic, but it's far more dangerous than anything we've seen on our horizon since the arrival of HIV.
Situation where there are upwards of 70,000 cases being reported worldwide. The majority of those cases are being reported by China, but nonetheless, about 25 countries have since reported cases. And where we know cases to be is in part determined by how countries are looking for cases. And so we shouldn't take away from this map that if a country is not listed, that means it doesn't have cases, or that how many cases a country is reporting means that they for sure have more than their neighbors. It could be very well influenced by how they are testing and how they're looking and when they began testing, etc. If you simply took the number of deaths that have been reported and divide that into the number of cases that have been reported, you would come up about a 2% case fatality ratio. Of the possibility that this could be, even 1% would pose burdens on health systems across the world. That is why this virus is getting the level of attention that it has been getting. I already referenced the 1918 influenza. Seasonal flu, you often hear comparisons to seasonal flu, and people are often urged to judge their risk of acquiring the virus and being infected with the virus with respect to their risk for other viruses. Certainly seasonal influenza, these are data from the CDC for a particularly bad flu year, to show that other respiratory viruses that we deal with every year do cause high numbers of critical illness, hospitalizations, and deaths. The question is, where does this virus fall in relation to those?
We don't know the origins of the coronavirus, and we're not going to know for quite some time, Jan, because the Beijing government is preventing everyone from finding out. CDC, the Centers for Disease Control and Prevention, they're not allowed into China. Also, the World Health Organization, they do have a team there now, but they're going to peripheral areas in China. They're not going to any place in Hubei province, the center of the outbreak. They're not going to Wuhan, the epicenter. And so, anything right now, I think, is open. When Senator Cotton says, we don't know, that's absolutely right. And that means when you don't know, you can't rule out. You can't rule out, for instance, that this was a release from the Wuhan Institute of Virology. So, of course, this has become a run-of-the-mill virus, has now become an epidemic, which could very well soon become a pandemic. The Institute of Virology, there is, a lot of people are saying it came from there. Now, we don't know that, of course, but we do know that The Lancet, which is the authoritative British journal, said many of the initial cases have nothing to do with that seafood market that everyone points the finger at. That couple in Canada who were caught, they were sending coronavirus samples to that Wuhan lab. So it doesn't mean that everything there was engineered, but it does mean it could have come from that lab. I don't think that they understand the significance of so I think that this is quite serious. It is worse than the numbers suggest. So for instance, today, China is admitting to 2,004 deaths. And that's got to be many, many multiples of that. They're admitting to 74,200 or so infections, many, many times multiple of that as well.
Well, and it's, I think you were mentioning the WHO a bit earlier, and it's, bizarre that, the WHO is obviously highly cooperative with the Chinese Communist Party.
That's a very, very diplomatic way of putting it.
Well, they haven't been allowed into the epicenter, ostensibly the epicenter, right? As far as I understand it,
they have,
right?
They're going to Guangdong, they went to Beijing. They're just going to, they might as well be going to Iceland for all of this. This is just ridiculous. And the World Health Organization sees it's more important to support communism in China than it is to end this disease. And so that's really wrong. I think the WHO Director General should resign. I think the organization should just disband, send the staff functions, the technical stuff to other places. But really, this is creating a very bad situation.
I was so scared. I was so scared of getting COVID-19 because there was no way to tell where the virus is.
Everything in their lives is false. We grow up being surrounded by well-intentioned adults that tattoo our brains with their old and outdated mentality. We are guided towards destinations that others choose for us, and we blindly accept this because we trust that the mature figures around us know better. We reach a certain age where we start to put into practice everything that we've been taught, and so we proudly enter into the 9-to-5 elite, who works to pay the bills and who lives for the weekends. Unaware of our capabilities, we pursue the cycle of working almost 50 years for somebody else, building someone else's dream. We become so detached from ourselves that we ignore any sign that our system might give us, as something is not right. We lie ourselves at the end of each day that we've done enough at work, and in the evening we deserve to get a taste of the comfortable lies that media has prepared for us. We open our ears and eyes to superficial entertainment, and we ignore the real struggle that some people are going through in the world. We consciously choose to live a life dictated by the flashy and shining advertisements, and so we buy into their consumerism scenarios. We stack our fridges with so much food that we don't make enough time to cook, and at the end of the week we throw most of it out. We are wasting huge amounts of food that so many on this planet would be thankful for. We've grown so attached to the collective mindset that we're afraid and embarrassed to go against its senseless norms. Why should I start reducing waste and recycle my garbage if others aren't doing it? Why should I focus more on ways of preventing pollution if others are not doing it? Your example matters, and you can start to dictate new and healthier trends. Ignorance has reached such high rates that most people are living in their bubbles of limited and square perspectives on the world surrounding them. Have we become so narrow-minded that we are not able to see what is really happening on the planet? Have we become so self-entitled that we take our lives for granted? When did we become so ignorant? Just take a step back and look around you. While you're crying for more likes and hearts on social media, children are crying for food and water. While you're sick and tired of the cold weather, people in Australia are struggling with disastrous bushfires. While you're blaming life, others would wish to have more life to live. We've been instilled with fear from the early stages of our childhood, and this carried on into our adult life. We're frightened at the thought that maybe the truth we've been served is not that true after all. We are scared of the unknown truth, so we decide to keep living the lies which we even end up defending as the permanent truth of life. We don't want to be finger-pointed by others if we try to do things differently, so we bow down to society's elites that use us to fulfill their superficial and maniacal goals. We refuse to open our mind to the possibility that maybe there's something else outside this narrow box of preconceptions and beliefs that we're living in right now. Every move we make is directed by the hands of greedy puppeteers who only want to gain control of the masses. Just look at how politics are made. Just look at the games they're playing with our lives and how we consciously accept them. In the end, we're the ones that vote for them. Politicians have understood that with instilling fear comes control, and this is what they're using in their campaigns. And what do? We're peacefully falling asleep as they're telling us their false stories with fictitious enemies, terrorists, and viruses. We pride ourselves as modern humans who live in modern times, yet we're still not able to accept different ideas and mindsets. We judge everything that's not aligned with our view, completely rejecting the possibility that diversity is a positive thing. We act as if everything we're living right now will last forever. We postpone calling our parents or friends to tell them how we truly feel, as if they're going to be near the phone ready to answer our call at all times. Life is limited, and it lasts more or less for each of us. Nobody gets a notice when this life will end, so stop postponing. Look at all of us, complaining about back and neck pains. Most of us spend so much time looking down at our devices that we completely ignore what we're actually doing to our body. We're so busy being social online that we forget how to talk to a real person, face to face. We fill our heads with unreal stories about what happiness should look like, about what a fulfilled life means, and we're on a constant hunt for others' approval through a like or a good comment. Why can we be smart about our smart devices? Why aren't we using this incredible tool to spread useful and healing information throughout the world? Why are we letting technology use us instead of us using it? There's so much going on in our environment that we choose to ignore. Nature's balance has shifted so much in the past few years, and we're the only ones to blame for this. We focus so much of our attention on building and developing technologies that we forget to take care of this humble yet important servant, which is our nature. We take so much from it, but we seem to never give anything in return. Look at all the deforestations we've done. Large areas of forests are cut down to make enough space for the urban tentacles to spread. We're not only killing vegetation that's important for removing carbon dioxide from the air, but we're also supporting greenhouse gas emissions. Deforestation is the second leading cause of climate change. We've polluted so much of our planet's lakes, rivers, seas, and oceans, and we're so amazed when media shows us how some people are struggling with murky, smelly tap water. Did you know that there are people who have to use contaminated water for their daily lives? In 2018, the Environmental Working Group showed that some 14 million Americans are using contaminated water with a cancer-causing industrial solvent. Did things change? No, they didn't. Why are we not seeing this? Have we become so self-centered that nothing around us matters anymore? What are we teaching our children? To satisfy their needs without paying attention to what effects their actions can have on the surroundings? We need to open our eyes and act before things degrade even more. It doesn't matter what we've done so far, either good or bad. We can now start from scratch. There is always something that can be done to restore the balance. We can change the world, even though one step at a time. It's not politics or media that will make the change. It's us, the people. Little by little, we can create new trends to show those that choose not to see that the planet needs our help. We can start small, because every step we take in the direction of caring more about the impact of our actions can lead to bigger changes. We need to take full responsibility for everything that we do in our lives. We can't keep waiting for others to make a change. We have to act now. At this very moment, we could be anywhere in the world sitting and thinking about ourselves. We could be watching TV from our comfortable couch, while also looking down at our smartphones to see how many people have liked our posts. We could be complaining that our internet is too slow, or that new episodes from our favorite soap opera are not on Netflix yet. We could be doing anything that makes more or less sense for our life. But what are we doing for others? We take and take and take from life, but what are we giving back? We take amazing photos of a green and blissful spot of nature in our trips, and we proudly share it on Instagram. But are we doing something to keep it green and blissful for others to see as well? We like to talk about the good deeds that we're doing on holidays for kids that need help, but what are we doing for them in the other months of the year? Their lives will not change with just one present. So what is the legacy we'll leave behind for our kids? There is so much that we can do to leave behind a clean and beautiful world for our descendants. So many people before us have done amazing things for our current comfort, like inventing the wheel, electricity, airplanes. the light bulb, and so many other things that we seem to take for granted nowadays. People have worked hard to make them happen, so why not do our part of the work as well? Why not create something now, so that those who come after us will have something to be proud of? Why not remain in history as the generation that made a world a better place?
Let me tell you why you're here. You're here because you know something. What you know you can't explain, but you feel it. You felt it your entire life, that there's something wrong with the world. You don't know what it is, but it's there, like a splinter in your mind, driving you mad. It is this feeling that has brought you to me. Do you know what I'm talking about?
The Matrix.
Do you want to know what it is? The Matrix is everywhere. It is all around us. Even now, in this very room. You can see it when you look out your window or when you turn on your television. You can feel it when you go to work, when you go to church, when you pay your taxes. It is the world that has been pulled over your eyes to blind you from the truth.
What truth?
That you are a slave, Neo. Like everyone else, you were born into bondage, born into a prison that you cannot smell or taste or touch. A prison for your mind.
Everything we think we know is a lie.
Yeah. History, who we are, where we come from, our religions, our food, our medicine, what this world is, quite literally everything is a lie. And that's why it's so difficult to ever really discover the truth and to wake up the people around us, because all of the information that we're even researching, most of it, has been falsified. That is why people are constantly locked into different belief systems, why they continue to argue with each other, and why they continue to perpetuate their divide and conquer programming. Because in everything that they're looking at and all the information that they've got, they never even factor in the reality. In any investigation into the past, which is invariably where we look to find out what happened and what brought us to this point, most of the information that we glean from old books about historical figures has been doctored, rearranged and rewritten, and in some cases it's actually even doubtful that many of these people even actually existed. In many cases, works were attributed to people who didn't do those works. In many cases, discoveries were most likely attributed to people who never made those discoveries. Many events were simply fabricated, and many people simply did not do what we were told they did. And as I said, in the case of many of them, it's doubtful that they ever even existed.